Are you experiencing irregular periods, unexplained weight gain, persistent acne, and signs of high testosterone? By the end of this video, you should have a better understanding of the signs of PCOS and how to have an educated conversation with your primary care physician about your concerns. Welcome back to my channel. If you're new here, I'm Mariah, and I help women manage PCOS and insulin resistance. Through practical tips, education, and tools, I'm here to help support your journey. With over 8 years of university education, including a naturopathic medical degree from CCNM in Toronto, I've guided hundreds of women to improving their symptoms, regaining confidence, and to just feel better. Subscribe to my free newsletter by clicking the link in the description box below, or feel free to check out my website at metabolicmo.com. In no particular order, let's dive into the 8 most common signs. Number 1 is irregular periods. Number 2 is unexplained weight gain or difficulty losing weight. Number 3 is acne, persistent along the jawline, chest, or on the back. Number 4 is increased hair growth in areas you probably don't want it to be. That's along the chin, around the breast tissue, back, stomach. Number 5 is infertility or troubles with conceiving. Number 6 is skin hyperpigmentation. That is darkening of skin in skin folds. That includes the armpits. Most commonly, it could also be around the neck, in the groin area. Number 7 is symptoms of high testosterone. That could be actual hair loss on the head. People may refer to that as male pattern balding in women. Another sign of high testosterone could potentially be a deepening of your voice. And then number 8, which is another common sign, could be polycystic ovaries. Now, what that means is on an ultrasound, your ovaries have multiple follicles in them, and we'll dive into what exactly that means. So now I'm going to break down each symptom a little bit more so you have a better understanding of it. So let's start with irregular periods. What does having an irregular period mean? So what that means is that your menstrual period, when you bleed on a monthly basis, it's actually not as consistent as what it should be. So on average, a woman will have a period every 28 to 32, 35 days, and that is considered normal. So an irregular period is actually either a shortened amount of time, so you're having a period less than every 21 days, or it's a lengthened period, and that could be you're having a menstrual period every 35 days or longer. An irregular period can also be defined as having less than 8 periods per year, or it could also be defined as having a menstrual cycle that lasts longer than 90 days. So there are a bunch of examples and explanations for what an irregular period is, but it's essentially if you fall outside of the normal range, then that is considered an irregular period. Now, what's interesting is that one of the first signs of PCOS is actually an irregular menstrual cycle. So you may have noticed in your high school years, teenage years, that as you even got older, your menstrual cycles never did get a solid pattern. Now, obviously, when you first get a menstrual cycle, it is going to be irregular. Your body's getting used to all the new hormones that's going on and increasing throughout the cycle. But it should eventually have its own cyclical nature by probably the age of 18 to 20, give or take. And number 2, the other common sign is weight gain. Not all women who have PCOS experience weight gain. Some may be considered or termed lean PCOS. At the end of the day, PCOS can cause insulin resistance, which long-term can contribute to excess weight gain, commonly in the abdominal area for women, but it can occur in other places as well. But that's generally where you might see the excess weight. And of an interesting note, weight gain can actually exacerbate or make PCOS symptoms worse, and it can contribute to the longer-term consequences that can occur with PCOS. So that includes conditions like type 2 diabetes, high cholesterol, high blood pressure, and something called metabolic syndrome, which is like a combination of all those conditions, and plus a couple others as well. And now we're going to talk about acne and PCOS. Acne can be a common sign in PCOS, but again, not every woman will have acne. But if you do have acne, it can be a sign of having excess androgens. So androgens are essentially male hormones. That's the simplified term of that. When you have excess testosterone in your body, one of the things that it can do is actually increase the oil production in your skin, particularly on the face, chest, or back. And that is why some women do experience excess acne with the PCOS diagnosis. And then building on that testosterone is another condition, that excess hair growth. Another term for it is actually called hirsutism. And what hirsutism is, that excess hair growth along the chin, along the mustache line, upper lip, It could be along the chest, around the breast tissue, on the abdomen, or on the back as well. And again, that is another sign that there is excess testosterone in your body. And we'll dive a little bit more into that in future videos. But again, that can be a common sign of PCOS. And then another sign has to do with infertility and or having trouble conceiving. Instead of it taking you 6 months to a year to conceive, it might be taking you multiple years before you're able to get a positive pregnancy result, or potentially you have not yet gotten a positive pregnancy result after multiple years of trying. And essentially why that comes into play with PCOS is that because there are irregular periods, menstrual cycles, you might not be ovulating. And you have to ovulate in order for sperm to essentially fertilize an egg. We can dive into that in more future videos if people would find that helpful. But essentially, that's one of the main concerns with irregular menstrual cycles is you often don't know if you're ovulating or if you're ovulating at all. And then that also has to do with hormonal imbalances. That has to do with the testosterone being too high. It could be with progesterone being too low. And then also hormonal imbalances with luteinizing hormone and or follicular stimulating hormone, LH and FSH. So another potential sign of PCOS is skin hyperpigmentation. And what that essentially is a darkening and a thickening of the skin in more specifically skin folds. And I had mentioned it earlier, but that could be on the neck, on the groin, under the arms and the armpit area. And that is actually linked to insulin resistance. And these skin changes could also be a sign of an increased risk of developing type 2 diabetes. And I've already talked quite a bit about excess testosterone and the signs and symptoms of that and how that relates to PCOS. I'm not going to dive too much into that. I think I've already hit on that with the potential hair loss in the head, hair growth in areas you don't particularly want it, and then again, a potential deepening of the voice that either you have noticed or potentially people around you have noticed. And then the last potential sign that we're going to talk about is the polycystic ovaries. So again, to dive a little bit deeper into what that means, when you have irregular menstrual cycles, so these follicles are immature eggs that have not yet matured to be able to ovulate. So they're all just accumulating in the ovaries, these little teeny tiny follicles. And one of the medical terms that people will often use to describe these follicles in the ovaries is called a string of pearls. And down the road, I will talk a little bit more about that and why sometimes that's seen in PCOS and sometimes it's not, but it can definitely be a sign of PCOS. But to actually diagnose PCOS, your primary care provider, your medical doctor, will more than likely use the Rotterdam criteria. And the Rotterdam criteria does take into account the symptoms that we discussed, but I am going to break it down a little bit more so you understand how the diagnosis of PCOS comes about. So in order to be diagnosed with PCOS based solely on the Rotterdam criteria, you only need 2 out of 3 criteria to have been met. The first criteria that could be met is irregular ovulation. The second criteria is having high androgen levels, and that can either be seen on blood work. So when you're getting blood work done, your testosterone might be elevated, or having signs of high testosterone, which is based on all the symptoms we just talked about. So the excess hair growth, the dimming of the voice, the losing of the hair on the head. You can have either blood work showing high testosterone or symptoms. You don't necessarily have to have both because sometimes they actually don't correlate. And there's a lot of reasons why. We're not going to get into that today, but maybe I'll explain that a little bit more in future videos. And then the third potential diagnostic criteria that you need to meet is the polycystic ovaries. In order to get diagnosed based on the Rotterdam criteria, you need to have 2 out of the 3 that were just mentioned. So you could have irregular periods and signs of high testosterone, and then technically you probably meet the criteria for PCOS. Or you could have polycystic ovaries and high testosterone, but you might not have irregular periods. As long as you meet 2 of the 3 criteria, then that will prompt your medical doctor to do further investigation to really see what's going on and if you do fit the PCOS diagnosis. Stay tuned for my next video where I dive into the risk factors of PCOS. If you found today's video helpful, please hit that subscribe button, and I know to continue making content for all of you.